Hello, nerds for Yang.
Hello, nerds!
Hello, nerds!
Hello, nerds!
Hello, nerds! So nerds!
Hello, nerds!
Hello,
Now with this
nerds!
campaign, bang, dang, it's and true. Come roll with the Yang Gang.
Hello, nerds.
Hello, nerds!
Welcome to the show, Dr. Goldstein. Can I call you Robbie for this interview?
Certainly, please do. Everyone does.
All right. So, Robbie, welcome to the Nerds for Humanity live stream. I heard you got endorsed recently. You had kind of an important one.
I think so. A pretty important one for our campaign. Andrew Yang and Humanity Forward endorsed the campaign a few weeks back.
Well, congratulations. So tell us a little bit about who is Dr. Robbie?
Well, I'm a doctor. I'm a physician at Mass General Hospital, although, as Andrew pointed out, I'm a doctor with a PhD. So I have both an MD and a PhD. I have been a doctor at Mass General Hospital for pretty much the past decade, providing both primary care and also infectious disease care. I'm trained in infectious diseases. I care for people living with HIV, folks in the LGBTQ community, and people affected by substance use. And actually, about 5 years ago, I established our hospital's transgender health program, and now I'm the medical director of that program and provide care there as well. So I'm approaching this race, this campaign, with that perspective and that lens of being a physician, working with folks every single day, talking to them about their healthcare.
Well, if part of your area of expertise is infectious diseases, we have to talk about the coronavirus. Like, what's your take on the current state of affairs? It seems like there was this initial phase where people were really very scared and buying toilet paper and going like crazy. And then there was a point where we all said, okay, we're all going to work from home. And then now I see sort of like a difference of approaches, not just within the US, but even like different countries are applying different approaches.
Yeah.
Here we are talking to a MD, PhD with experience in infectious diseases who works at freaking Mass General. What's your take? Because I'd rather hear from you than a lot of the talking heads.
Well, I'll say probably unsurprisingly to this gang that's going to be paying attention to this live stream, my take is based on the data and the science behind what's going on. I think you're right. In the beginning, there was a lot of fear, a lot of, in some ways, panic about what was happening. Toilet paper was, right, on short order. You couldn't get bleach wipes, all of those things. And we saw a lot of physicians and scientists really come out in public and talk about what was happening. And I think we did a lot of great things in that first phase, shutting down businesses and schools in an effort to decrease the spread and flatten the curve. It actually worked. In a lot of the states that were really hard hit, the curve actually flattened. We saw less infections. We were able to prevent infections and deaths because we did what we had to do. I think we've entered another phase now. We've entered a phase where we've been in this social distancing setup for 3 months. We are all eager to get outside and to get back, to bring our economy back, to do all the things that we usually do in the summertime. But we have to remember that this infection is still out there. And there are many states in this country that are having rising numbers, increasing numbers of infections every single day. We are still seeing people die from this. We are still seeing hospitals overwhelmed from the virus. My state, Massachusetts, I have to say, has done a pretty good job. And we actually are one of the only states that has decreasing numbers day after day. We're doing the hard work of social distancing. We're doing the hard work in the hospitals to get people better and to get people out of our ICUs. But what I worry about is that there are a lot of places in this country that aren't listening to the scientists and aren't paying attention to the data.
So in those scenarios where people they become impatient and maybe they're also saying, hey, people aren't dropping like flies, as far as they can see. What do you think is the worst case scenario for either states or regions where they're pretty much skipping to, the phase 3 or 4 and kind of opening business as usual? What do you think is the risk there?
I think there are a lot of risks. We could have a second wave. We could have a second wave that's larger than our first wave. We could see those that are most vulnerable, those that it's harder for them to do social distancing, those that are essential workers and frontline workers, we could see them overwhelmed by this virus. We saw what happened in New York City, in Seattle, even in my hometown of Boston, when the numbers increased to a level that really overwhelmed the healthcare system. That was in phase 1. If phase 2 or wave 2 is even worse, those cities are not going to be able to handle the number of people that are coming into the hospitals. And we're going to see people suffer. We're going to see people die from this infection, when really all we have to do is listen to the data, listen to the physicians, the scientists, the public health experts who are telling us we have to wear masks, we have to stay at home, we have to do the hard work of distancing ourselves.
So how do you respond to people who say, maybe I work in a job, or my state has many jobs that, they're not these knowledge worker jobs where people can hop on a Zoom and, do their work from their home office. And this is really harming families and hardworking people who need to pay the bills. Yeah. And, and then also like parents who are kind of trying to almost losing their wits with the kids running around and, not being able to go to school and yada, yada. Like, how is your view like, well, that's just, that we all have to suck it up? Or is there some middle ground where people can still take care of their family and be safe and responsible?
I think it's really hard. It's really hard. There are certainly people who can't work from home. They can't work over Zoom. They can't telecommute, right, in the way that other more fortunate people can. There are businesses that require us to go out into society and to walk into the doors of that business to buy a coffee, to go into the retail shop and buy something that keeps the shop going. And we have to recognize that fact. But I also think this is going to be really hard for all of us. This is going to be a really challenging year for all of us as we try our best to prevent the spread of this virus. And it is incumbent upon our government to help us out, right? And we'll probably talk about this later, but emergency cash payment and emergency cash relief, UBI, right now in this moment, is an essential part of our government to make sure that people can continue to exist and thrive and survive, even when they can't leave their house, even when they can't get to that job that doesn't allow them to telecommute. It is our government's job to help us through this crisis.
Yeah, I noticed on your website that one of your priorities is financial security. Yes. And I also noticed that it talked about relief during the crisis, direct cash relief. Was that a explicit choice not to support basic income beyond that? Or how did you sort of arrive at your position on universal basic income?
Well, I'll say first that financial security has always been a part of my platform. It's always been something I've thought about. And in particular, I think of financial security as a key component of healthcare. You can't be healthy if you're not financially secure. You can't have prescriptions, you can't go to the doctor, you can't do all the things you have to do if you're not financially secure. So it's something we've been talking about since day one of the campaign. But I'll be honest and say, basic income was not something that I was talking about at the beginning of the campaign. And COVID happened, and like it did for so many people in this country, it changed my perspective. It changed my understanding of how important income is and basic income is. It changed the way that I thought about policy. And it allowed me to begin to think about what is the role of basic income in our society. I think right now we have to deal with the emergency direct cash payments that are necessary in the setting of COVID. We've got to get that through. And I actually think there's the political will to get that through during the time of this public health crisis. I think we have enough people in Washington on the right and on the left who agree that we've got to help people through. And so I have thrown my support fully behind the legislation that Senator Harris and Senator Markey have put forward to talk about $2,000 a month for every citizen in this country. And I think once we get that through, then we can move on to talk about, okay, how do we make basic income a part of the national conversation going forward, right? Let's get it passed so that money can get into people's pockets right now. And let's utilize, in some ways, the political support that we have because we're living through a crisis to get it through. And then let's make it a long-term reality once we get there.
What was it like talking to Humanity Forward and I guess any conversations with Andrew when you were being considered for the endorsement? I'm curious what that process was like and how it went down.
Well, I have to say, I love the Yang Gang. They've been amazing to sort of work with, both at the local level, and the Massachusetts Yang Gang has been a tremendous support for this campaign, but at the federal level as well, and Humanity Forward. I'll say a few things about the interactions. One, they're really smart and they love data and science, and it really is helpful because it's what I like to talk about. Two, they're super efficient, and Humanity Forward allowed me to have a direct conversation with them about what I stand for, what my platform is, why I'm in this fight. And so that was really helpful. It didn't feel like I was going through multiple layers. And then, so the third thing is that I was able to directly have a conversation with Andrew. And he's an amazing, amazing man who was incredibly generous with his time and with his knowledge. He really helped me craft my message in a better way. He allowed me to ask him questions, present scenarios to him and get his feedback and his opinion. I could not have asked for a better experience as I was going through the endorsement process. And I think they, it's been a two-way street. I've been able to ask them questions. They've been able to ask me questions. I've taught them. They've taught me. We're working hand in hand to try to move this campaign forward.
That's great to hear, and I'm glad that you had a good experience and you're getting help from the Massachusetts Yang Gang. They're legit.
Yes, they are.
I'm curious, Robbie, how did you decide to run? I mean, you're a PhD, MD, you're working at Mass General. Like you've kind of, accomplished a lot, and you're in a great spot. You're married. You've got it all done. Why in God's name would you put yourself out there
so this
join that mess in TC?
This is actually something I talked to Andrew about, right? Because he also came from sort of not being in government to going into the government space. And I'll say a few things. One, I'll say I actually think that medicine and government are a lot more similar than people believe them to be. At their core, both are about helping people. Both are about making sure people live a healthy life. And so I don't feel like I'm going into something totally different. The other thing I'll say is that being a physician, being a primary care doc in many ways, allows me this opportunity to talk to people one-on-one every single day and hear how challenging life is. And I think I would challenge you to find any primary care doc in this country who does not say to you, we've got to fix the system. The system is rigged against so many people. We've got to get out there and fix it. And I heard it over and over and over again. I heard it from my patients that are living with HIV. I heard it from my patients that are fighting the system in the substance use space. I certainly heard it from my patients in the transgender health program, how hard it is to just live and exist and have that healthy life with the current setup. And there wasn't a light bulb moment. It wasn't like all of a sudden, oh, I'm going to run for Congress. It was conversation after conversation, building upon itself, making me realize it's time for somebody with a healthcare perspective to get into this race. It's time for us to have the right voice in Washington so that we can fix the system for everyone.
Let's talk a little bit about the healthcare system. I mean, I feel like every 4 years we have this debate, And one side says, well, we need single payer. The other side says we just need to allow interstate competition, maybe health savings accounts, that kind of thing. What if you had to try and summarize for people what you think are the key problems with the American healthcare system? We'll go to solutions in a minute, but what ails us now? Because on the one hand, we do have some of the most advanced healthcare capabilities and research in the world. Mm-hmm. We're the envy of many countries in terms of our medical schools and our research programs and pharmaceutical companies. So what do you think what's the biggest problems that we're encountering now? What are the causes of those problems?
I think there are three problems facing the healthcare system. One is access. We don't cover every person in this country. We don't provide coverage for every person in this country. We don't treat healthcare as a human right. We treat it as a commodity that we can trade and buy and sell. The number two problem is cost. Year after year after year, we are paying more and more and more for our healthcare. Yes, we have the best medical schools in the country or in the world. Yes, we have, we are the envy of the world when it comes to pharmaceutical development and innovation and all of those things you're talking about, but we are paying more and more and more each year for it. And I think the third problem is that we have always siloed healthcare to itself and said healthcare is about access and the price we pay in pharmaceuticals, and it's all really confined in this space, right? But really, healthcare is so much bigger than that. Housing is healthcare. If you don't have a safe house to go home to, there's no way that you can be healthy. Financial security is healthcare. If you don't have the money to pay for your prescriptions and pay for the doctor's visit, you're not going to be healthy. Transportation is healthcare, right? We've got to start thinking about healthcare in this broader sense. So I think until we address access and cost and expand our view, we're never going to move ourselves in the right direction in healthcare.
So what would you propose we do? Those I think a lot of people would agree that those are all problems that we've all observed in our day-to-day life, access, cost, and sort of like the total health of a person. What can be done in DC to get us closer to a better outcome?
Well, I want to go back to something you said, which is that I actually don't think there are two sides to this issue. You would think that it would be Republicans saying, let's do the health savings plans and let's think about interstate commerce, and Democrats would all say that we should move towards a single payer system. But there are all many different views in this argument. And in fact, the person I'm running against is a Democrat, and he voted against the Affordable Care Act. He voted against healthcare expansion in the way that we believe that Democrats would fight for healthcare expansion. So I think the first thing is we've got to make sure that our side does argue for and push for the right policies and what we all believe is the right way to move forward. What is that way? I think that's a move towards a single payer healthcare system. And I believe that because a single payer system allows us to address two of the three things that I talked about. It allows us to provide access to everyone in this country. It can be mandated and it can be spread out across every state if it's all with one insurance company, right? One government-run insurance company. And it allows us to control cost. When we have only one person or one company, one entity controlling the access and controlling the negotiation of drug prices and reimbursement, we can begin to put in the cost-saving mechanisms that we need to flatten the curve of healthcare expenditures, or maybe even reverse the curve of healthcare expenditures and get the cost to decrease year after year.
So let me play devil's advocate, because I have many Republicans in my family, and until 2008, I was consistently voting Republican. One of the arguments I've heard to what you're proposing is, look at Canada. People have to wait 3 years to see their doctor. It's rationed. And then the second argument I've heard is, Well, if the government is going to force private enterprise to accept certain low costs, the quality will go down, innovation will go down, new research and development will be, reduced. Any thoughts on those criticisms?
Lots of thoughts. I'll first say that, people oftentimes compare an American single payer system to Canada or the UK. And fundamentally, we are a different system. We will be a different system. We are a very different country. Those are countries that have relied on a public insurance plan and public hospitals to provide care all across the country. That's not what's going to happen here. We are going to have private hospitals, private healthcare institutions, and public hospitals and public healthcare institutions. They're just all going to accept the same insurance plan. So we're not saying that, if you want to come to Mass General, you've got to wait in a line, or you're going to be pushed over to this hospital that may be closer to your home. You're still going to have the choice of where you want to go, the doctor you want to see, the system that you want to be a part of. But you're going to be guaranteed coverage no matter where you go. Now, it's going to have the benefit of saying that if you live in rural America and there's a hospital right there, that hospital is going to get reimbursed for the care that it provides you, and you can go to that hospital. Instead of what's happening right now, which is that rural hospital isn't getting reimbursed for your care, and that rural hospital is closing, and rural hospitals all across this country are shutting down, and people are now without health care. So it is going to allow us to build a system off of our public and private institutions, but just expand coverage, universalize coverage. So that's my first statement to the sort of Canada, UK example, and I hear about it a lot. I think the second thing is that, arguing that we're gonna tamp down innovation, we're gonna change the overall American idea of pushing for innovation, constantly pushing for higher quality, pushing for a better system. I think that's fundamentally opposed to what we are as Americans. I think we're always going to fight for a better system. We're always going to fight for the better treatment. But we right now actually don't have the ability to innovate because the costs are being dictated by somebody else. The costs are out of control. When we put a cap on the cost, it will now all of a sudden create a system where healthcare institutions have to innovate. They have to change how they deliver care. They're going to have to do it in a cost-effective manner. They're going to have to do it in a way that provides better care at a higher value without increasing the cost year after year. So we're actually going to drive a lot of innovation, a lot of discovery. We're going to force people to think hard about how we deliver healthcare in this country and how we do it in the best possible way at the lowest cost. And I think that's part of America, right? That's the American idea of, every year we're going to innovate and we're going to try to drive down the cost. That's our system that we have here. And I don't think that's going to change just because we move to a single payer healthcare system.
Why do you think the country is so divided on this? I mean, I've had debates with, my Republican friends, and it's almost accepted as a fact that Obamacare was just a complete disaster. And thank God Trump rolled back some of the ACA provisions. And I wonder, even if you get there, you're going to have to work with folks on the other side of the aisle who might be reasonable, but have constituents who are just kind of, really dogmatic, that they don't like socialism or anything that even looks like socialism, or anything that looks like Obamacare or ACA. And it seems like we're stuck. Do you have any thoughts on how you avoid being, one of these well-intentioned, super smart people that go to DC and then kind of either get sucked into the system or throw up their hands and say, whatever, I gave it my shot. Yeah. How would you try and help us do something that we haven't done as a country for a while?
I think some of it is language, which sounds like a weird thing to respond to that question with. But, I actually think, there was all those studies, remember, about how many people hated the Affordable Care Act versus how many people hated Obamacare. And it's all about the language that we use, right? If you say, oh, do you want to make sure that your kid up to the age of 26 can remain on your health insurance? People say, of course I do. And if you say, do you support the Obamacare rule that would allow people to expand coverage? People say, oh, I disagree with that. There's a language component here. And I think we've got to get better on the single payer side and on the Affordable Care Act side. We've got to get better about how we use language. I also think that we've got to start sort of flipping the argument a little bit. One of the things that I hear from people who are more conservative, Republicans that are in this district, people who don't agree with my position on a single payer system, is we can't afford it as a country. We can't afford to make this massive change. We can't afford to spend that much money on healthcare. And my answer to them is always, we actually can't afford not to. We have to start talking about how much money are we going to save if we move to a single payer system. And if there's one thing that Republicans like, it's to save money. Well, theoretically, that's the ideal of the conservative side, to save money, to decrease taxes. Let's show them how we can actually do that by moving to a single payer system. We can actually lower the overall cost of healthcare, and we can begin to decrease the expenditures that we are putting out there every single year. I think we've just got to be smarter. We've got to be smarter about the way we describe this, the words we use, and the arguments we use to bring people onto our side.
Do you think there's a way to move in that direction gradually? I think one of the things that people are worried about is it's such a big, complicated system today that if we changed it, tomorrow, the nightmare scenario that other people paint sometimes is like, well, you'll wake up tomorrow and your healthcare will be gone, and you'll just get some phone number with a constant busy signal, and so people get really worried like that. It would be a big change. How do you kind of ease people into it?
I have to say, I actually think the biggest issue I took with the presidential primary, the Democratic presidential primary this year, was that it created this false choice for people. That it was either in January 2021, we were going to have a single payer system, or January 2021, we were going to double down on the Affordable Care Act. And that's actually not what the plans were. If you look at Andrew's plan, and you look at Joe Biden's plan, and you look at Elizabeth Warren's plan and Bernie Sanders' plan, all of the plans were moving us in the same direction, and that's to universal health care. All of them would eventually get us to a single payer system. And actually, all of them came up with the same steps to get us from where we are now to where we have to go. Expanding Medicaid in all 50 states, lowering the age to get onto Medicare, right? Making it easier to provide coverage to more people across this country, and then putting in realistic benchmarks. I think those should be financial or economic benchmarks that allow us to know when we're ready to move to the next step of universalizing our coverage, the next step of moving towards a single payer system. I don't think that this is going to happen in one day. I don't think it's going to happen in 1 month. And I actually don't think it's going to happen in 1 year. I think we've got to look at this as a long-term plan about how we shift from where we are to where we have to go. And in some ways, capitalize on each step, show to the opposition the benefits of each step, both financial and in the healthcare space, expanding coverage.
Are you worried at all about not just the conservative voters and congressional representatives, but the industry kind of incumbents? I mean, it's a very big business, and there are players that make a lot of money in this industry who may not want a single payer system. They may actually prefer the current approach. And they have resources to make arguments and resist. What are your thoughts on how you kind of either work with or kind of overcome opposition from the health complex? Because it's a big there's a few dollars sloshing around there.
More than a few, right?
Yeah.
More than a few dollars. I mean, there's a huge question here, a huge fundamental question about money in politics and the influence that business can have over what our government's going to do, the oversight and the regulation and all of those pieces. And we should have that conversation. But I think in the healthcare space in particular, I actually invite healthcare institutions and insurance companies and pharmaceutical companies to the table. Let's have a conversation about how you can continue to innovate, how you can continue to deliver care, how you can be a part of this single payer system. When we look at Medicare, which is sort of the best example we have in America of a single payer system right now, right? It's not that the federal government is managing every little piece of Medicare in every state. Actually, the federal government sets the fee structure. They do a lot of the negotiation, and then they work with local partners, local businesses, private organizations to deliver the care that's necessary, the care that is most appropriate in each setting. There is no reason why we can't continue to do that in a national, universal healthcare system with a fee schedule negotiated by a central organization from the federal government, but delivery being managed in some ways by these very local organizations and local companies. I think we actually want people to be a part of this system. To go back to sort of what we were talking about before, everyone else in America has had to innovate. Everybody else, all other businesses, right? If Apple didn't innovate, then Apple would not continue to exist as a business. I think that private insurance and healthcare institutions should also be asked to innovate. And they've got to figure out a better way to deliver care. And they can do that within the context of that single payer system, be a part of our overall system, rather than fighting against us, fighting what is right.
Is there a role for the private insurance companies in a single payer system? Like what would their future look like?
You know, you can imagine something where the private insurance company is helping in the overall healthcare delivery and helping to manage the care that exists within, you know, a network, saying we're going to help with the community health workers and the home nurses and making sure that the imaging is connected to the healthcare providers who need to see the imaging results and all of those pieces. In the same way that private insurance is involved in Medicare right now, in making sure that a network exists for people who are in Medicare, making sure that all of that information stays together and can be transmitted to the right people, making sure the community involvement is part of the Medicare delivery process. I think that's a great example, actually, of how we can use private insurance and private companies to build off of a single payer system. What we just have to do is make sure that it's not the private insurance companies that are driving the cost of care, and they're not driving who can enroll in care. They're helping to drive the delivery of the care. Got
it. We could spend the whole interview talking about healthcare. It's such a complicated subject, but I really appreciate you, Robbie, shining a light on some of it. One last healthcare question before we move on to other topics. For the COVID-19 stuff, how concerned are you about that second wave? And then secondly, how concerned are you about other types of viruses like this? So like maybe we get a vaccine early next year and we think we're out of the woods, and then boom, some other thing happens. Do you feel like this is going to be the new normal? So just any thoughts on how we get out of this current situation and the long-term view?
For this situation, I have fears about a second wave. This is part of me being an infectious disease doctor. I think we're cautious by nature. We are risk averse. We want to do everything we can to prevent people from getting sick. And so I do have this concern that as we see more people going into businesses, as we see more people walking around without masks, we are going to see an increase in the numbers. I'm hopeful that we don't see that. I do think masks work, social distancing works, being outside and not having people inside your home or having businesses where you have to walk inside the door, that it does decrease the spread of this virus. And so I'm hopeful that we're putting in the right data-driven approach to prevent the second wave, but it is something that I worry about. I do think that we have to talk about the second part of that question, which is, can this happen again? And the answer is absolutely. Right. This happening this year was not a surprise to those of us in medicine, and certainly not to those of us in infectious diseases. We have been watching the first SARS virus. We've been watching the MERS virus come out of the Middle East. We watched Ebola. We are watching these viruses emerge all across the globe. and we're preparing for this pandemic. We were preparing in medicine. We were preparing in public health. The federal government wasn't. And that has a lot to do with who's been in Washington over the past 10 years and the decisions by a Republican Congress and now a Republican president to defund our public health infrastructure, to take billions of dollars out of the CDC, out of the National Security Council, out of the NIH, all organizations that were helping to prepare us for a potential pandemic. And that about $8 billion that was cut from all of those organizations resulted in a $2 to $3 trillion expenditure to try to get us out of this current pandemic and economic recession, right? If you look at it that way, it was a very small investment to prevent what is now an enormous cost to our country, let alone all of the illness and deaths and everything that has come from people getting sick. So I think that we have to make sure that the right people are in Washington and who are having this conversation, who are prepared to prevent the next pandemic, who are prepared to use the data to make sure that the right programs are in place so we don't go through this all over again.
So in that scenario where the CDC and the NIH, the national security programs were not defunded, what would have been different? Wouldn't we still have had the virus come on our shores and we'd still have to, shelter in place? And how would it have changed?
Absolutely, we would have had the virus come here. I'm not saying that those programs could have prevented the virus from coming to America, but we would have had the right national stockpile to make sure we had enough ventilators and we had enough personal protective equipment. We would have had the right scientists and the right investment in the space of developing the next treatment or vaccine, right? Actually, our most effective treatments and our most effective vaccines are coming from prior work in Ebola and other coronaviruses. And if we had invested more, we probably would have had more in the pipeline, more that would have been able to get quickly turned around and brought to market and potentially have resulted in less death, less infection. I think that's what we should be looking at, right? It's impossible to say that we're going to prevent all pandemics forever. We know that's just not possible. That's just not true. But it is possible to be more prepared. It is possible to prevent the degree of damage that this pandemic caused.
So I grew up, in the 80s and, have lived a few decades now. And I don't remember this kind of global pandemics being common. Is it like, do you feel like, well, this is going to be more prevalent now because maybe we're in a more international world and there's just more kind of travel and stuff like that? Like what happened? Why are these viruses showing up? It seems more frequently now, or maybe it's just like it appears to me like it is, but
no,
I don't remember. Yeah. Well, what's behind it?
Yeah, I mean, you've got to go back to 1917, 1918, and the Spanish flu to see the last major global pandemic where we had this amount of infection and this amount of death. And now it seems like SARS and then MERS and then Ebola and then now COVID, right? Just one after another after another. And the short answer for you is climate change. Yes, it has some to do with our overall transportation and how international things are now. People can go from one continent to the next. But a lot of it, much of it, has to do with climate change. And the fact that we are encroaching on areas of this globe that we've never been before, where these viruses exist, and where it becomes easy for them to be transmitted to animals, to mammals, and then eventually to us. Climate change has changed the patterns, which, where animals live, where insects live, where viruses may exist. And so it brings them into contact with more and more humans. This is part of going back to what I was saying earlier, right? We've got to look at healthcare as much bigger than just that tiny little thing about what happens in the doctor's office. Climate change is healthcare. And until we address that fact and really invest in a strategy to deal with the climate crisis, we're going to see these viruses continue to come up and continue to present themselves in ways that we're going to then have to react to in our public health institutions.
That's really interesting. I hadn't heard that sort of root cause of climate change impacting habitats and man's kind of proximity to different animals and things like that. Yeah, that seems plausible for sure. What's your? I know a lot of us were disappointed in the president's leadership on this. Certainly, in like January and February and March.
April and May and June.
But I'm curious, what's your take on like the CDC? Because I was surprised that they were kind of wringing their hands on whether or not we should do masks. And then when I go to the CDC website and try to look for data on testing, it was like 10 days delayed sometimes. And I don't know if that's all Donald Trump's fault. Any thoughts on how, the CDC has handled this?
And the CDC has always been the world premier public health institution. It has been the institution that has helped us figure out what was the causative virus of AIDS. It has helped us think about public health in this much broader sense. And we have exported that knowledge to other countries and really led the way in public health around the world. And over the past 3 months, we have not seen the CDC live up to that reputation. Why? I don't know all of the root causes there. I'm not exactly sure what was going on behind the doors of CDC. I do think that a lot has to do with President Trump and his reluctance to fund the CDC, his reluctance to listen to the scientists of the CDC, those that may be appointed politically into the CDC who may share the president's views and may share the president's distaste of science and data. And I think that does in some ways influence what we saw from the CDC. I think we saw instead the NIH really come out with leadership here. And in particular, Dr. Fauci come out with true leadership, talking about what is truth, what is fact, how do we prevent the spread of this virus, how likely are we to see a vaccine, what's the timeline, all of those pieces that would traditionally come out of CDC and not the NIH. We saw sort of that responsibility shift a bit over this crisis.
Did you watch any of those briefings? Those at one point were daily briefings.
Yeah, I watched a few. I ended up throwing too many things at my TV, and my husband told me I had to stop watching them. So I stopped watching because they were just upsetting.
What was the most upsetting part of it? I mean, they had Fauci and Birx up there. They seemed pretty thoughtful.
Yeah, no, it was not the physicians or the scientists that were up there that were upsetting me. It was the president largely that was upsetting me. It was the idea that the president could dictate what the best treatment is for coronavirus, even though he has no clue what treatments are. That the president could express really wild and crazy ideas about things that people could do to their bodies that would actually only cause harm, but that he was suggesting could be a treatment for coronavirus. I mean, that's irresponsible. It's dangerous. It is not what our president should be doing. And those are the moments that got me so angered that I had to eventually stop watching before I broke something.
Yeah, it was a strange thing. I mean, like, I think the idea of providing transparency to the people is great, but it suddenly became more of a political kind of, I remember when they were showing like political ads during the briefing, and it's like, okay, this is great, but let's get down to the facts and what we need to do. Yeah. But so let's talk a little bit about transportation. I noticed that was a priority on your website. And as someone who enjoyed using the T system in Boston years ago, and then now I live in Switzerland with an amazing transportation system, I'm curious, what are your thoughts on America's opportunities there? Because on the other hand, yeah, we've seen other countries do it well. I was in Tokyo the other last year and was blown away by how amazing that is. But we know that Amtrak always loses money, that people, they don't want to give up their cars, and we have a much bigger physical nation than most other places. What are your thoughts on how to make transportation better for America?
I think we have to think about things at many different levels. So public transportation, and talking about the MBTA here in Boston, or whatever the subway system may be called in any city across the country, the commuter rail system, the Amtrak system, those are really, really important. We've got to think about how we invest appropriately to connect the right parts of our country. That's part of the problem, is that we actually haven't connected the right cities, the right towns. We don't have the transportation in the area that we most need the transportation. But I actually think about this in a very, very hyper-local level too, and think about sidewalks and bike lanes and how much we could actually do if we made our sidewalk safer and we put a bike lane in every street. How many cars would we get off the road? Because you might say, you know what, it's actually a nice day, it's really easy to walk, and there's a really safe path. Or here's a great bike sharing program that allows me to bike this distance in 2 minutes rather than drive my car in a round and round circle that might take me 15 minutes. So I think we've got to combine some really big structural changes in our public transportation and where we build roads and how we use our railroads all across this country, innovate in that space, but also think about things at that really hyper local level.
Yeah, you remind me of something that happened a year ago. A colleague of mine had friends visiting from the States. Actually, it was her parents. And I was like, oh, how's it going? And she said, oh, well, they're adjusting to kind of the Zurich lifestyle because they were visiting for a couple of weeks. And I said, what's the hardest thing? Is it the language? And they said, no, it's that they're not used to not driving everywhere.
Yeah.
Because here, like you take the bus, you take the train, and it's not like some stigma attached to it. It's just everybody does it because it's clean and it's efficient. And when it comes to healthcare, every time I go back to the States, so I've been living out overseas for a few years. I'm moving back next month. But whenever I come back for business, I notice when I'm watching TV, these ads for cheese stuffed pizza, triple size, for $1.99, this kind of thing. And I wonder, no, they do like the cheese here, but not quite that quantity. And I'm curious about people's individual choices affecting their health. So this now goes back to the healthcare conversation, where I wonder, in a world and a society where we are constantly moving towards, processed food and fast food, that's often not super healthy, and then we don't walk that much. How much of the problems that ail us are around our kind of customs and our lifestyles?
Yeah, it's all interconnected, right? The food that is available and inexpensive is not the food that is maybe local and healthy and going to be both better for our climate and better for our bodies. We have to readjust our priorities in that space. The same is true for our transportation system, right? It is at this point easier to get in a car and to drive someplace in America rather than take the train or the subway or walk or take a bike. We've got to readjust our priorities. I do think it's possible and completely doable. We actually are seeing it happen right now with COVID, right? We're seeing people who are using less gasoline, right? They're not going out and driving their cars. They're not sitting in traffic. They're using sidewalks and they're walking around and taking bikes. We're seeing people who are cooking at home because there aren't restaurants to go out to, and so they're not as dependent on some of those other foods. We're seeing things change because of the current situation with COVID. And let's see us sort of extend those changes, make those more a reality going forward, and not just sort of what happens right now when we're on the social distancing lockdown period.
Yeah, no, that makes maybe this crisis will give us an opportunity to consider, evolving how we do lots of things, and maybe that will be one of the good outcomes of this.
That's the optimistic view of everything.
Yeah, well, I'd love to take some questions from the audience. So folks in the chat, feel free to put your questions in there. And while we wait for some questions from the audience, Robbie, I did want to ask you another thing, which is aside from healthcare and transportation and the financial security, is there another area that you feel your constituents would benefit from, having you out there advocating on their behalf?
Climate change, for sure. It is something that, I have been talking about since day one of this campaign. And it is something that the people that I talk to all throughout the district want to talk about. It is top of their mind. And that has a lot to do with the fact that this district in particular is all along the Boston Harbor, all along the coast. And because of that, people are experiencing the real and immediate impacts of climate change every single day. They're watching their streets flood. They're watching their homes flood. They're watching what happens when sea levels rise. And, it's something people want to talk about. I believe that this is the biggest threat that is facing our globe right now. And we've got to take immediate action on climate change. The person I'm running against thinks it's a political problem and something that we should take 50 to 60 years to address. It's a very clear difference between me and him. And the people of this district are ready for somebody who really deal with the immediacy, the urgency of climate change.
Well, that relates to our first audience question from Jeckalego, who's also a channel member. So thank you for your support, Jeckalego. He wants to know, how are you different from the incumbent, Stephen Lynch? What are some ways that you think you'll be different?
So I just shared one, which was climate change. I oftentimes say this is about votes and values. We would, he's a Democrat, although many of his votes over the past 18 years that he's been in office would not be in alignment with what most Democrats would vote for. So he voted against the Affordable Care Act in 2010, like I said earlier. Mm-hmm. He voted against reproductive rights and describes himself as a pro-life Democrat. He voted against LGBTQ rights for many, many years and continues to be a very slow and reluctant supporter of the LGBTQ community. All very different than how I would have voted and how I would have led in Washington. And I think I just said the word led, right? And how he has led over the past 18 years. I think that's a huge difference. His way of leadership and my style of leadership. His way is not saying much, not doing much, not really advocating or pushing. Mine is to use my voice every single day to speak out for those that are most vulnerable, those that are left out, those that need a louder voice and someone to amplify the challenges that they're facing. And I think it's really time that this district has someone who's ready to use their voice and to speak out for the people that need it.
You mentioned, did you say he was there the last 18 years?
Yes.
Okay. Wow. What's your plan if you got in there? Would you want to go there for a couple terms, or do you think you could contribute? I mean, lots of people that are in Congress and Senate have been there a long time and have done great things. So it's not necessarily a bad thing that people are there for a long time. I was curious, like your time horizon, what you're thinking about.
I'll say right now I'm mostly focused on September 1st, which is the primary.
Sure.
And I want to win on September 1st, and then we can make some decisions. I haven't said anything about, or really even thought about what happens next and where I go from here. I do think that the one thing that is core to everything I've done from the moment I started college and have worked on my way to becoming a doctor and to do all the work that I've done in the hospital and now in the campaign is that I want to help people. I want to help people live a better life. I want to help people really get the most that they can get out of our society. And so wherever this road takes me, it will take me on that mission to help people to make sure that they're living a healthy life. Maybe that's in the House for some time. Maybe that's leaving government and moving over to something else in the private sector or coming back to medicine. I don't know the answer right now, but I know that the mission will be the same.
Right on. Landline has a medical question for Dr. Robbie. If the infection rates go up, will we ever be able to get out of our house this summer? I mean, because it seems like in some states it's kind of ticking up now, right?
Yeah. So, states like mine and Massachusetts were actually decreasing, but states like Oklahoma and Texas and Arkansas and Alabama, we're seeing increasing numbers day after day. I'll tell you the truth. I think until we have a vaccine, it is going to be really hard for any physician to advocate that we get out of our houses and we go back to living our quote unquote normal life. I think we need that vaccine, or we need a really, really effective treatment and widespread testing so that we can make sure we're testing people, getting those people that are positive onto treatment. I don't see that happening over the next 8 weeks. I don't see that happening over the summer. Just think it's going to take too long to get that treatment on the market, to get that vaccine out to enough people. And so I think we're looking at a very different summer than we've ever faced before. We're looking at a summer where people are wearing masks at the beach. We are looking at a summer where our barbecues are parties of 2 or 4, right? Just your immediate family that are there in the barbecue in the backyard. It's not going to be the same as it was last year.
Man, that summer sucks, Robbie.
I know.
But
I'm sorry.
I know. I'm it's not, that's the reality of having a freaking virus running around. A question about the fact that this is not going to be like any other summer. Boston's a big tourist destination, and then the fall's going to come around. People think Boston, they think all these colleges and universities. Do you think Massachusetts, how do you think it's going to do with that kind of impact?
I think states all across this country are going to have a really hard time with budgets this year because a lot of states depend on tourism. A lot of states depend on young people coming there for college or for a job right out of high school or out of college, and all of that's going to really stop. And we're going to have to make some tough decisions in Massachusetts. Tough decisions about what gets funded and what doesn't get funded. We didn't talk about this during this past hour, but there's this really broad conversation, right, about funding our police departments across the country and having a conversation about racial justice. And I think we've got to bring into those conversations this idea that we're not going to have as much money as we had last year in our state governments. And where do we want to spend that money? I'm a big advocate for saying we should spend that in education, in community programs, in systems that are going to actually improve the safety of our streets, and making sure that we get that money to the people that can use it the best to help everyone out. But I think Massachusetts is in for some pretty hard conversations because of the lost income that's going to come from this virus.
Laura Lane has a question about, also a channel member. Thanks for your support, Laura. How do you convince physicians to support single payer if they will make less money?
And this is a question I get a lot. One, I'll say that actually there's a tremendous number of physicians that support a single payer healthcare system. And there's a broad network all across this country, the Physicians for a National Health Program, that support a single payer healthcare system. It is primary care doctors and emergency medicine doctors and surgeons and OBGYNs and people from all different specialties who support a single payer system. What we're really trying to do is convince those people that are on the business side of medicine that it's the right thing to come over to the single payer system. I do believe that everyone who got into medicine got into it at some point to help people, right? That's why we become doctors. That's why we become nurses and EMTs. It's about helping people, helping them be healthy. And a single payer system is the way to do that. And so every time I talk to someone in the medical world who doesn't agree, I really try to go back to that idea of we're in this to help people. How can we best help people? It's not about ourselves, right? We're just one person in this huge system, and we've got to think about the bigger system.
All right. Last question I have for you, Robbie. Well, maybe just one or two more. But one of the last ones is, you're in Massachusetts. You had a senator running for president. What was your take on Yang's run for presidency, and what are your thoughts about his prospects in the future?
I was impressed. I have to say, Massachusetts voted on Super Tuesday. So by the time it got to Super Tuesday, a lot of people had dropped out of the presidential race. And we were left with our home senator, who I voted for in the presidential primary here in Massachusetts, and just a few other choices. But I was really impressed with Andrew's run. I mean, he went from having very little name recognition and really expanding his base dramatically. A lot of help with the Yang Gang, getting his name out there, getting his positions out there, but really driving the conversation. And he was there on the debate stage, every single debate. He was able to be a part of that conversation. And I think that's really, really impressive. I have to say, in talking to him, I think he's got a long future in public service. I don't know what it looks like. Maybe it's another run for the presidency. Maybe it's something else, an elected office. But I think it is certainly in the effort of public service and of really trying to help as many people as possible and to drive the conversation to the right values.
So you're not quite ready to endorse Yang 2024, it sounds like, but you might consider it.
Well, let's see what happens in November 2020 and who we elect, and let's see where we go from there, because I think the number one goal for all of us should be that in November we elect a Democrat and get Donald Trump out of office so that in January we can have a new administration.
Right on. Well, Robbie, last question for you is, how can people who are learning about you through this interview get more involved, get connected with your campaign? And, if they want to, how can they help you out?
Well, I'll say you have it at the bottom of the screen, but people should go to my website, which is robbieforchange.com. There's a link where you can join Team Robbie and be a part of our volunteer force, be part of our phone calls and our text messages and our digital outreach program to try to get the word out about this campaign. There's also, I'll say, a link at the top to contribute. This is an entirely grassroots-driven campaign. And so for those of you who are able to, I would appreciate any support that you could throw my way to help us get everything out there over the next 2.5 months for the primary on September 1st.
Right on. Well, you heard it from Dr. Robbie. Go check out robbieforchange.com. If you can contribute, please try and consider doing that and volunteer. As a reminder, Robbie's campaign was vetted and endorsed by Andrew Yang himself and Humanity Forward. And as someone who loves data and science and making, helping people think harder, I think Robbie checks all those boxes. So hopefully, Robbie, we will see you in DC. And I just want to thank you again for coming on. And with that, we're going to say goodbye, nerds.
Bye, nerds. Thanks for having me.